Welcome to Dental Kids. I'm here to explain what to expect during your frenectomy consultation and, if recommended, your infant's frenectomy treatment. One of our Dental Kids team members will be in shortly to review the medical history and ask you questions regarding your infant. Following this initial information gathering, the doctor will conduct a knee-to-knee examination and perform a more in-depth review of the details you have provided. The doctor will collect any additional information needed to determine whether a lip, buccal, and/or tongue release is recommended. You will have time to ask questions, and we encourage you to speak openly. This allows us to provide the most accurate diagnosis and make appropriate recommendations for treatment or referrals for outside support if needed. If a release is determined beneficial, a CO2 laser will be used to release the lip and/or tongue tie. The primary advantage of laser revision is the ability to ablate and coagulate soft tissue simultaneously. Because of this technology, there's typically little to no bleeding, and the laser's bactericidal effect results in a very low risk of infection. The laser produces a short numbing period that will wear off 1 to 2 hours after treatment. If local anesthetic is determined appropriate to use, the numbing of the local anesthetic will wear off 20 minutes to an hour after treatment. During the procedure, parents will remain in the consultation room. The doctor and her assistant will bring your infant to our treatment room. Your infant will be swaddled. We provide swaddles, but are happy to use one of yours if you prefer. One assistant will be responsible for documentation, photographs, and suction, while a second assistant helps stabilize the patient and hold the protective laser glasses in place. For infants under 2 months old and weighing under 10 pounds, we use Sweeties for pain management. Sweeties is a medical-grade sugar water that helps soothe the infants before and after procedure. For infants over 2 months old and weighing more than 10 pounds, we can use local anesthetic in addition to Sweeties. The anesthetic is administered with a very short needle into soft tissue in the treatment area and produces quick, short-term numbing. This is not the same as a dental injection, which is designed to numb more broadly and takes longer to take effect. When local anesthetic is used, mild bruising and bleeding at the injection site can occur. Once the procedure is completed, we will return to the consultation room to review the stretching exercises. Stretching exercises are to be performed for 3 weeks, a minimum of 5 times per day, with each stretch being held for at least 3 seconds. For optimal results, we recommend performing stretches every few hours and never going more than 6 hours without doing them. If your child sleeps longer than 6 hours, you will need to wake them to perform stretches or attempt them while they sleep. For the lip stretch, gently lift your infant's lip upward so that it appears as though you are pulling the lip over their nostrils. For the tongue stretch, place your fingers on the floor of the mouth and elevate the tongue until you can clearly see the diamond-shaped treatment site. A paper with aftercare instructions will be provided. You will be asked to perform stretches before being discharged from the clinic. We will provide gloves for you to wear. At home, you may choose to wear gloves or ensure your hands are thoroughly clean and nails are short. The treatment site will be red or blue after treatment and will turn white as healing progresses. This is normal and resembles what a scab looks like in a moist environment, similar to the knee scrape after removing a bandage following time in a pool. If your infant's lip is released, it is normal to see swelling or bubble lip within the first 12 to 24 hours. One of our Dental Kids assistants will be with you shortly to answer any questions you may have.